Good morning, everyone, and welcome back to another session of NCLEX session. We are now in part 7. I am Diane Anderson. I am a professor, and I've been a nurse for over 20 years. My main area of expertise is critical care, PCU, IMC, ER, and so on and so forth. I discussed more about myself in the earlier parts 2, 3, and 4, if you should want a little bit more detail about me. But I think we should just get started. Let's jump right in. I put some pretty easy questions, I believe, for you. These should be questions that you should get right away the answers to. Let's see how you do. Question number 1. A registered nurse is assisting a patient with a feeding tube. Which action is correct when administering medication through a feeding tube? Is it A, mix crush medications with a small amount of water before administration? Is it B, administer medications directly from their original tablet or capsule? Is it C, flush the feeding tube with medication and water simultaneously? Or is it D, use a large syringe to administer medications quickly? If you chose A, mix crush medications with a small amount of water before administration, you are correct. I know some of you might be saying, well, why isn't it D? Why aren't we using a large syringe to administer medications quickly? Or why isn't it C, flush the feeding tube with medication and water simultaneously? It wouldn't be D because you don't want to administer anything very quickly. All that's going to do is cause the patient to vomit and cause more problems. And you don't want to do C, which is flush the feeding tube with medication and water simultaneously, because usually you're going to check the stomach for any stomach content or residual in the stomach prior to even administering anything to that patient. You want to pull back a little bit on the syringe and see if the patient has a lot of fluid or food still in their stomach. And with most hospitals, you're going to document the amount of cc's that you actually aspirated and checked prior to giving the medications. Some hospitals require that, some do not, depending on if there's strict I's and O's involved. Also, yes, the medication will be mixed with water, but you're going to usually also flush the medication with some water after you administer the medication as well. So doing it simultaneously and not following up with an additional little flush is usually not the case. So that's why it wouldn't be C. Okay? Question 2. A registered nurse is caring for a patient with a new tracheotomy tube. What is the nurse's priority when providing tracheostomy care? Is it A, clean the inner cannula before reinsertion? B, change the tracheotomy ties daily? C, change the tracheotomy tube weekly? Or D, remove the tracheotomy tube during care? If you chose A, clean the inner cannula before reinsertion, you are correct. Now keep in mind, usually in a critical care environment, whether it's the ICU or the IMC, usually the respiratory therapist takes care of this particular task, but the nurse also needs to do it as well, or at least know how to do it. In certain patients in particular, ones that are at high risk for decannulation, those are only to be done by the respiratory therapist. Usually what they do is they'll post a large sign above the patient's head of the bed, letting you know that they are high risk for decannulation. And with a patient like that, it's best for the respiratory therapist to perform that intercannular cleaning when they take it out and reinsert. Okay, so just check with your hospital policy and check with your respiratory therapist when you're caring for that type of patient. Question 3. A registered nurse is caring for a patient with a history of falls in the hospital. What is the most appropriate nursing action to promote the patient's safety during ambulation? Is it A, encourage the patient to ambulate independently to build strength? B, keep the patient's call light out of reach to avoid distractions? C, ensure that the patient wears appropriate non-slip footwear? Or D, limit the patient's ambulation to short distances to minimize fatigue? If you answered C, you are correct. Ensure that the patient wears appropriate non-slip footwear. Keep in mind, too, if the patient is unsteady, you should be assisting that patient up, out of bed, into chair, out of bed, to ambulate in the room, etc. Don't just let it all rely on the socks that the patient wears that are non-slip. Okay? Question 4. A registered nurse is caring for an older adult patient with impaired mobility in a long-term care facility. Which intervention is essential for preventing pressure ulcers in this patient? Is it A, reposition the patient every 8 hours? B, use a donut-shaped cushion to relieve pressure? C, maintain the head of bed at a 30-degree angle? Or D, perform a skin assessment regularly and implement a turning schedule? If you chose D, perform a skin assessment regularly and implement a turning schedule, you are correct. In most facilities, our turning schedule is every 2 hours. You want to check that, of course, with your facility, but that's pretty much standard at most facilities. You want to turn or reposition the patient every 2 hours, especially if they're not a patient that can turn or reposition themselves, okay? Some facilities also have wedge cushions or extra pillows and different things you can also use to help prop the patient up when you are turning them side to side. Question number 5. A registered nurse is planning care for a patient with a new diagnosis of diabetes. What teaching should the nurse provide regarding foot care? Is it A, wash the feet daily with hot water and pat them dry vigorously? Is it B, inspect the feet daily and apply lotion between the toes? Is it C, trim toenails straight across to prevent ingrown toenails? Or is it D, avoid wearing shoes to allow the feet to breathe? If you chose C, the answer is correct. You want to trim toenails straight across to prevent ingrown nails. Now, this is a catch with this one. That is usually the rule of thumb, especially if the person's in the hospital or a nursing home environment. But keep in mind, the key thing is the patient is a diabetic. So you really want to check with your policy at your facility, because even though C is the answer to the question, a lot of facilities would prefer if the patient is seen by their diabetic doctor or podiatrist to get their toenails cut if they are a patient that has diabetes, and that's for risk of any possible infection or bleeding. Usually patients with diabetes have a lot of circulation issues, especially in their extremities, okay, whether it's their fingers or their toes. And it could lead to infection and other problems up to, unfortunately, even a lawsuit. So a lot of hospitals don't want to get involved with that, or they don't want to take that chance. So they'll, tell the nurse to tell the patient, follow up with your podiatrist or follow up with your primary doctor. But check with your policy at your facility, because I have been to other facilities that are still fine with us trimming the toenails, long as we're doing it straight across, as the answer implies. Now today, this was a short session. I want to also remind you guys that SkillSnacks offers personalized tutoring, one-on-one or in group sessions. We do it online. So if you'd like to learn a little bit more information about that, just contact us at admin@skillsnacks.org for additional information involving costs and time frames available, etc. Our goal is to get you to succeed in not only passing your NCLEX exam, but if you also have issues with, let's say you're still in class and you're working on certain papers, Or even if you are a nurse who has already graduated from her, let's say, her associate's degree or her bachelor's degree program, and you're now working on your master's degree and you need assistance with certain papers or certain projects, or you just want some questions answered to assist you in that journey, we also do that as well. Please don't forget to like and subscribe and share this video with others. Thank you again for your time, and we'll see you soon with the next session. Have a great day. Bye-bye.